Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568, and phone number 408 687 1899. Anytime when you are suffering from any disease at any age, call me for your second opinion of the disease, for the second opinion of your treatment. To the best of my knowledge, I will give you the opinion free of cost. So you can call for that 408 687 1899. And even if you want to be treated by homeopathic system of treatments, a scientific approach to your health, homeopathic basically is a systematic approach. All other systems, yes, they are having their values at their own place. Allopathic is required where we need the emergency management of anything, any pain, any problem, immediately to manage the thing. Yes, you need that one. And especially when you are concerned only with the body. That at that time, the most favorable thing is the allopathic styles. But wherever there are system has been damaged by some of the serums, excretion or secretions of the body, the best thing is the Ayurvedic system of treatments, which deals with your kapha pitta vayu. They are changed their ratio, they are changed in their structures because of the change of hormones, enzymes inside the body, and that is the best treatment for under those conditions. But if you are suffering since long with all these treatments, allopathic, Ayurvedic, or what else, and you are not getting well, and then you have to woke up your inner power, that is the vitality. Because vitality, even with all the helps, all the required maintenance you are doing by allopathic systems or the Ayurvedic systems, even then your vitality is not woke up. Under those conditions, you need to woke up the vitality so that is any type of help given to the vitality will be effective, and it will be able to control the diseases, control the disease process, control the health in its normal structures. So, homeopathic system is the last approach, you can say. But better if you at the first instance take the homeopathic system of treatments, it will be more better because you will not pass through the complications of the medications which generally in allopathic style we are suffering from, because every medicine you see, it has its instructions. Follow the instructions. Contact your doctors if you have any this kind of symptoms, or contact this number to the companies who is making, and the pharmacists, so that if you have any type of adverse affections, effects of this medications, means to say that all the medications are just forcefully suppressing the symptoms, and they are not listening what the vital force needs to be. And under those conditions, especially vital force itself is trying to maintain its status quo of the health, but because of the some influences outwardly or the inwardly, they are overpowering the vitality's power. So that is why vitality becomes weak, and we need to woke it up. But when you take allopathic style of approach, means forcibly you are suppressing the symptoms. And on the other hand, when you are talking about the Ayurvedic system of treatments, yes, it is far better than the allopathic system of treatments because it is specific. Nowadays, actually, every system is going to follow the allopathic type of directions, and even the Ayurvedic doctors, they are also making the medications, treating the patients just like on specific basis. These are the antibiotics for the pneumonia, These are the medicines for the stones. These are the medicines, this and that. All these things. When we are talking about this kind of treatment, it means we are forgetting the actually principle of Kapha Pitta Vayu, actually principle by which this Ayurvedic system is guided for. So in this way, both the systems we are discussing, allopathic and Ayurvedics, sometimes they are not reaching up to the mark which is required by the vital force. So under those conditions, the homeopathic system remains in our side because it listens the vital force. What the vital force wants to say, just like I explained many a times, whatever happen inside this body, it is indicated by change of symptoms, it is indicated by change of behavior of this body, it is indicated by change of every type of functioning of this body. And if we follow those instructions, if we follow those symptoms produced by the vital force after being after being impressed or influenced by the other noxious agents, then we can give the similar type of help what is required by the vital force. But the systems I discussed just now, the allopathic style and the allopathic styles, they are just dealing with the physical symptoms mostly. They are dealing with the physical symptoms. And even just like I talk about the Ayurvedic systems, they are not following the principles. Most of the doctors, not all, most of the doctors are not following those principles. They are following a style of allopathic, and they are preparing their medications and their combinations according to the allopathic styles. This is medicine is for cholesterol, this medicine is for the stone, this medicine, and this, and all these things have no relation with their basic principles. And until and unless we follow the basic principle of Kapha Pitta Vayu, why they are increased, why the ratio in between them is increased, until we follow those one and select the medications which can change their altered ratios and bring it to the normal ratios, then we are the same. Just like allopathic style, Ayurvedic doctors are the same. Whereas I'm recommending the homeopathic system of treatments, it listens. It is only based, not based on the, oh, these are the, though most of the doctors are still in homeopathic. They are also doing, these are the medicines for the stone, these are the medicines for the headache, these are the medicine for this and that. So by name of the disease, they are having their group of symptoms, group of medicines, and they are prescribing similarly for those. Most of the symptoms they are covering, no doubt, but not always they are curing. This is also the same procedure they are following, which is followed by the allopathic system and the Ayurvedic system. And unless and until you follow the basic principles of homeopathic system of treatments, you will not be able to cure any patients, because the symptoms are produced by our vitality, which is responsible for all the functioning of this body. Sensation and functioning of the body is the responsibility of the vital force inside. If there is no vital force, there is no symptoms. Dead body has no symptoms. In this way, that has only decompositions, and there's no living symptoms. And living symptoms are only present if the vital force is present inside this body. And vital force, if ever it has, just like we have any bite of the insects, immediately we cry, immediately we scratch that part of that ones. But this is an indication by the vital force that something has happened which forced me to scratch, which forced me to eradicate that by means of scratching or by means of this, whatever the symptoms are produced. In this way, if we follow these instructions of the vital force according to homeopathic principle, and we select the medications on the basis of those symptoms which are produced by the vital force under any influence. Under any influence means under production of any disease. Then selecting the medicine on the basis of these symptoms, yes, we will be curing the patients. But as I told you previously, most of the doctors nowadays, they are following the trend which uh, which even the patient desires. A patient comes and the patient says, "No, I have this thing. Doctor, do you treat this thing? Doctor, I have thyroid. Do you treat this one?" And doctors are selecting the similar symptoms, similar medications which specifically are concerned with that those kind of symptoms, but not always. But not always, because every person is individual patients. Every person has its individual reaction from every action. And many times in these lectures, I have described about this one. Suppose I can explain you. You have 4 5 parts of colors, and one color separate you have at hand. And now the color which you are having at hand, one scoop of that color you are mixing in each and every pot. And ultimately you will see every part is giving a different stain, a different type of color. And though the same quantity of that color has been added to all the pots, but they are having their different stains. Even if the color present inside the pot has its own identity of this is blue color, this is red color, this is whatever, yellow color, green color, whatever it is. But if the quantity of color you are having at hand and mixing it to all the different parts, the similar quantity, it will not change. It will give different color in all the parts, because their individual color, what they were having previously, has mixed up with this color, and the combination is dependent upon the color which was there already. Suppose if there is no color in the pot, and you take one color and you put the same color in the same every pot, it will be the same color. But the individuals are different in their sensitivity. Every individual is individual, means separate from the others. It's not similar to the every person's. No, it's separate from every individuals in their sensation, in their feelings, in their functionings. In this way, in this way, every person, if is suffering from any disease by any influence outwardly or inwardly, means we just like the persons are pots. Persons are part of different colors. And any disease, just like you are talking about the malaria, you are talking about pneumonia, you are talking about tuberculosis, every disease influence which affects the different persons, they will produce some of the symptoms which are not matching with all. Yes, definitely. When we diagnose it, this is TB, this is pneumonia, this is pleurisy, this is rheumatoid arthritis, this whatever we are naming the disease, these are some peculiar symptoms which are produced by all the individuals falling sick. But if you characterize it, if you identify each person with their individual characters, you will see there is a difference of symptoms. Up to diagnosis of any type of disease, yes, it will be same. But after that, the individual criteria, how an individual person has been affected by any disease, by any influence, that will be individual. I can make it more simple. All the persons are bite by mosquitoes, and ultimately they are having a common symptom of malaria. Common symptom of malaria means there will be shivering, there will be fever, there will be high fever, then there will be a sweating, and ultimately the fever will go. Again, after second 2 days or alternate day, it will again the same pattern will be revised. You saw, because there are different kinds of the malaria. Okay, oh, it's a malaria. Everything which is coming up with the shivering, which is coming up the high temperature, with coming up with the and going off with the sweating, it's malaria. This is what we understand that one. But if you minutely absorb the symptoms of each sick persons, then you will find out of all the malarial persons, all the out of malarial patients, you can say, they are having some of the individual characteristics which are not matching with the other malarial persons. Just like, oh, even though there is a chill, I need to drink a cold water. There is a heat inside. I feel something heat and I need to drink water. Oh, even then, I have a shivering, but I do not want to cover the body. No, I feel internal heat. I do not want to cover the body. Same thing, different symptoms, different area, different individual, they produce when they are suffering from the diagnostic same name. The disease diagnosing is the same name, but the individual characterizing thing is a different. That indicates us that every person needs a different medicines to approach that. And if on the basis of these individual characteristics we do not select the medications which matches with this individual characteristic, for that person it will not be cured. It will never be cured. It will be suppressed. It will be suppressed by the strongest medicine, whatever is going on for the quinine or many other medications are given, and this Azardicta, or and there are many more other medications which are previously given for the malaria, and they are attached with the malaria. Similar the thing is done in allopathic style, just like I told you about the quinine. Similar type of things are given, just like I called about the Azardicta. But when you talk about the individual characteristics, because with these medications, the previous symptoms will be relieved, but it will not go off forever. It may come it again on the systems. Not only for the malaria, it is just for the example. There are various other diseases, but other symptoms, and the patients comes time and again with the similar type of symptoms, because we are by other medicines treating the important symptoms of the disease, and we have made a combination, we have made medicines to suppress all these kind of symptoms, and you have suppressed that. But if the causative factor which has produced any type of disease is still there, if causative factor of the disease is still there, means mosquitoes, just like, because it's an easy example, you can understand that. And if mosquitoes, you are still living in the same thing, once the quinine has cured, once the Azardicta name has cured that one, again you are living at the same place, they will not cover up this thing to reappear it will reappear. It will reappear, because we have not made the vitality stronger enough to combat with this type of criteria of producing the malarial symptoms. In this way, if you take individual characteristics of an individual person and you select your medication, the individual medication, because the symptoms are individual. These are the individual symptoms of each patient, which are not matching. Pneumonia symptoms are matching with each patient. Malaria symptoms are matching with these patients. Tuberculosis symptoms are matching with these patients. But there are some individual sensitivity type of symptoms. They are different in each patient. And that is the actually version of our vital force. What the vital force wants to convey us and want us to understand to help this thing. Because malaria produced by mosquitoes, yes, you can get rid of this one. You can get rid of this one, and you can remove that site, or do you remove the patient from this where there is no malaria, malarial parasite anymore, or you can wipe out all these things, the causative factors for any disease. But anytime when you suffer from similar type, you encounter with the similar type of things which produce the disease, he will suffer again. But the principle of homeopathic is not only to eradicate the disease, but the principle of homeopathic makes your individual body, individual vitality strong enough so that if ever next time the same type of infection comes over, it will not allow him to overpower. Means it will not allow the system to suppress and produce the disease symptoms, because vitality has become stronger enough. Means another I will say, just make it more simple. If you have something wrong inside your home, any tap or anything is wrong, you call any carpenter or any plumber or whatever, and they come over. When they come over and they said, okay, tell me what's wrong, and they said, okay, sit down and I will do that. He does that thing, everything is okay, he goes back. He goes back. This was done. But next time, if ever it will happen again, ultimately you will call him again. Whereas homeopathic system says, if anything is wrong inside your kitchen, inside your tap, and inside anything, any your instruments are not working, then you call a person who knows to how to correct that one, and then he comes, he tell you, okay, I can tell you, you can do that. I can tell you can do that, and he tell you and you do that one, means now you have become competent. You have become competent for this kind of things, and next time if it happens, you will not call the person. This is what I want to convey you. The homeopathic system, when we deal, and it has been verified many a times, thousand, you can say since 1790, this was eradicated, and ultimately since then it has been proved and verified many a times. And you can verify it again if you select the medications on the basis of individual characteristic of a sick person. They are individual characteristic other than the disease. Disease means diagnostic name. Other than the diagnostic name of the disease, forget that malaria, forget that tuberculosis, forget the name of the disease, because the disease is, this is not easy, and not easy has, these are different explanation based on the physical symptoms. Malaria, pneumonia, tuberculosis, bronchitis, whatever we name, they are the effects of influences, and they have changed the physical functioning of our body, by which you diagnosed and you give individual name to any disease. But you forget that one. You forget this one, that the person who is individually suffering from this kind of symptoms has its individual demand, desire to eradicate this present condition. Plus, it should not come up on the system again. The vitality should be stronger enough. If ever the similar type of conditions happens, it can combat himself. Do not need any medications for this one. And you might have seen many a times, many of the diseases in nature. Now there are complications, many diseases are coming time again, but in nature's process, many of the diseases were coming once in lifetime. And ultimately, this vitality learns this thing, how it appears, and ultimately, vitality is continuously combating everything which are deteriorating the life process. And ultimately, in due time, that disease was gone. Those symptoms of the disease were gone, just like pox. You see, it comes in once in the life. But ultimately, we learned some of the processes that they can suppress this type of things. They can suppress once these type of conditions. And nowadays, you can see many patients, they are having repetition. They are having repetition even of the pox, mata. And then it's not only the pox, varicella, mumps, measles. There are many other diseases which are repeatedly coming in one individual because whatever treatment we have done, it has suppressed the disease once, but it has not improve the quality of vital force, quality of our living force. That is why, if ever the similar type of infection, similar type of exposure, a patient falls in, he suffers again from the similar type of symptoms. Means the disease is repeated. Whereas if homeopathic medicines are selected on the basis of individual characteristic symptoms, because these are individual in each patient, these are individual in each disease, and then ultimately that are those type of treatments which are based on the individual characteristic of the persons, are improving the quality of vital force, quality of the living force inside the body, which is responsible for the abnormal or abnormal functioning of this body. When it is overpowered by any influence, it produces disease symptoms. When it is not overpowered by anything, it's running its normal life in the body. So means a power which is inside the body and we are healthy. A power, the same power, if it is overpowered by any other influence, we are sick. And I say power, vitality, vital force. I used all these words because when a person dies, eyes, ears, nose, all they remain the same, but they do not work. Weight remains the same. What gone out? It's vital, it's power. And powers, you cannot see them, but you can realize them when the powers are acting on any physical substance, physical body. Electricity. You have a wire. You do not know whether it is having electricity or not. It has a power or not. But when this wire is connected to any instruments, to phone, to computer, to light, and they work, it indicates this thing was not working previously. We have touched this wire which was having a power. The same way, the vitality is a power inside our body and responsible for all the functions what our body can do. All the functions are done by that vital force, though through the body. Bodies are instruments. Tube can give light, phone can work and we can phone, computer can work in a different way, but the power is the same. So same power when exists inside our body, different organs work differently. Eyes can see, ear can hear, and we can speak, hands can work. In this way, each disease, when they affect the individual person, they produce their important characteristics of the disease primarily. But if you see minutely and watch that person, because in allopathic and Ayurvedic we have just discussed, they just see those symptoms which are diagnostic of a disease, by which they can give a name to the sickness. And actually the sickness is the actual response of our vital force, of our power which is inside the body, against the influences which are producing the disease symptoms. Mosquito is not producing disease. Mosquito is not producing malaria. This is what I want to convey you. Mosquito acts on your blood, acts on your body, and the influence of that is forcing our vital force to react in a different way, which has shivering, which has high fever, which has sweating, gone off. Same way, magnet. A magnet is attracting the iron particles, and it is only possible if they are in contact with that, but you cannot see that. You cannot see that how the magnet is affecting this iron particles or this iron stuff, but we see it is happening. The same way we see the mosquito, it is affecting, it's touching, it's doing this thing, irritation of our body. But whatever that influence of the vital force or is poison mixed into the blood, and is reacting, vital force produce some symptoms. Most of them are coming in a group and named as malaria. But some of the symptoms, they are not grouped as part of the malaria in our books, in our research. No, they are recognized as individual symptoms of the person. That's why I said all the malarial persons will be different in this character. All the different malarial patients will having a similar symptoms of the malaria. That is the diagnostic of the malaria. But if you treat the patients on the basis of a diagnostic symptom of the malaria, it means we are suppressing the things. It means we are calling a carpenter or a plumber or anything, and he is working in our home and correct the things and go away. Ultimately, if this thing go wrong again, you have to go back to him. You need again the same quinine, the same Ajardicta, same whatever you are taking for that one, Gilo, and many things are given in the Ayurvedic system, just like Karanjua, and all these things were given. So I mean to say, when you are treating any patients on the basis of diagnostic name of the disease, it means you are suppressing those symptoms. And the influence of that thing which was causing the disease symptoms and diagnosed in a different name, when it reappears after that, patient will suffer from the same thing again. But if by means of individual characteristics, that this is the weak point of the vital force, that if this kind of malarial parasite, quadriceps or whatever, this type of malarial parasite will affect this person's, these are the symptoms of malaria. But there are some attached symptom of the individual characteristics, and those individual characteristics, if you take those symptoms into consideration for your treatment and treat them, forget the malarial symptoms. This is my experience of 52 years. Forget the malarial symptoms. And this is what going on in homeopathic science and the practice. Since 1790, it was originated, and since then it is being practicated. And we have thousands of examples of this kinds. When you treat a patient, whatever, even it may be cancer. I'm treating the cancer patients. I'm treating various type of chronic malignancy diseases, but I am not treating the cancer by name. I am not treating the diseases by their disease names, though to explain to the patients, yes, so that he should understand that this doctor knows about my disease, so that he can have a faith on me and get his treatment. But actually, what we are doing in homeopathic systems, we do not treat the name of the disease. No, we treat the individual symptoms of individual persons, maybe with the same name of the disease. And when we treat the patient, when we select the medications on the basis of individual characteristics, which is different from the disease diagnosis, it means this portion of the vital force is weak. If this kind of influence comes, again, this weak point will be weaker more, and it will be forced to work according to that influence, and the individual symptoms will come up every time. And if you make, just like my arm is a weak, and there is a tingling or numbness or whatever, I explain, oh, doctor says it's arthritis, and they give me the medicines for the arthritis. Ultimately, after some time, with the injections, with the tablets, whatever, it's cured. I feel better. Ultimately, the reasons for producing this kind of numbness, if comes again, the doctor will repeat the same thing. Even the patients are of the habit. They're saying, Doctor Sahab, I was suffering from these conditions, and last time after 6 months you gave me the same thing. Why not you give me the same injections? I will be okay with that one. And doctors are doing the similar type of things. Suggested by the patient in spite of suggested by the doctor. But if you treat similar type of patients based on the individual character, forget its rheumatism, forget its gout, forget the name of the disease, and based your treatment on the basis of some individual characteristics which are different from the diagnostic name of the disease. Because we have the we know the symptoms. Arthritis, when you say arthritis, means this means inflammation. There is inflammation in the joints, and all the inflammatory signs will be there. There will be difficulty in the movements, there will be swelling, there will be redness, there may be fever, whatever. And we diagnose that rheumatism. But at that time, we forget the individual characteristic, the internal sick person, internal sick man of this body. This body was having pain in the joints. This body has been treated forcibly to suppress those symptoms. We use the word forcibly. We suppress those symptoms by forcible medications, and ultimately, after some times, the patient becomes okay. And if the causative factor is still continued, he will not improve up to the extent of health. He may improve, but he may not say, oh, I am fully okay, I'm fully cured from that one. No, he may have some symptoms, and ultimately those symptoms may elevate under circumstances. And until and unless you collect his individual characteristics and treat those individual characteristics and select the medications on these individual characteristics of the patients. This will not go, though it will take time, because we have to woke up the vitality, we have to make stronger our vitality, we have to help this one, so that the things, the symptoms which were appeared because of the environment, because of any food materials, and we were having a pain in the joints, and doctor has diagnosed rheumatoid arthritis, and there are still individual characteristic produced by these type of you can say the food materials, the environments, and whatever has caused this rheumatic type of symptoms. These symptoms are only diagnosing or giving us a diagnosis, name of the disease, but at that time who is suffering, what he needs, but he needs to combat this kind of condition, so that he can combat with that one. If it comes again, then it will not come again, because the vitality will be stronger enough. All will learn this thing, that if this kind of environment was responsible for the rheumatism, now the vitality will become stronger towards this kind of influences of the environment, and it will combat. If a disease is occurring from any type of food materials, and you treat him, symptoms symptoms will go off, but not totally. Or if it go totally, you see that the patient says I'm okay, ultimately after sometimes, because you have not taken care of the causative factors. So with that, you need to improve, to look after the causative factor as well. But what I am saying, this is something different from this one. Yes, a person is having sore throat from pickles, from taking curds, from anything sour. He is having sore throat. So this shows the individual sensitivity from individual substances in a person. In one person, the individual sensitivity of a person which is sensitive after taking pickles, and he is having sore throat. And now our target should be that, first thing, we immediately to see the effects. Immediately to see the effects, we should find out, we should survey about all these things. What is causing this disease? First of all, we should give the precautions to the patients that not to use this thing. But does not it mean that we are saying hands are up? No, 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 no. You are not to take curd lifelong. You are not to take pickles lifelong. You are not to eat this thing lifelong. Is not it a hands are up? That we are backing up? That we are accepting the defeat? This is what I want to convey you. That the medical science is day to day improving their standard of health, how they cure the patients, and now up to we are at the standard that we should collect the individual characteristic of the patients irrespective of the name of the disease. I'm saying irrespective of the name of the disease, maybe cancer, maybe arthritis, because there are different names of the cancer: myeloma, papilloma, lymphoma, but there are sarcoma. There are many names of this one. But I am just talking that whatever may be the name of the disease, forget that. Just take the symptoms. And just take the symptom and give more importance to the individual characteristics. It means I am saying forget the name of the disease. Just in a jaundice, pilia, everybody has this yellow urine. Everybody who has this yellow eyes. Everybody has a Gteric index raised. Means whatever is done, whatever this causative factor has changed inside our liver, inside our body, and it is bringing up outwardly symptoms of yellow urine, yellow eyes, yellow skin, and many other symptoms which we are diagnosing this jaundice. But if you treat that one, ultimately the same person may suffer. I am using a may suffer. It is not necessary that he may, but he may suffer from the similar type of disease in life again, because we have not make our vital force stronger to combat this type of influences. For that, we need to find out the individual weakness of our vital force. Individual weakness of our vital force. And that is represented by individual characteristic of the symptoms which are not always in the jaundice patients. A group of symptoms which is diagnosed as jaundice, take it separate. Take it separate. Then take some individual characteristics, desire, aversions, feelings, all these things into considerations. And then, on the basis of these symptoms, select the medications. And then, whatever the medications are coming up for the prescription for this individual patient, check whether they are covering the disease symptoms or not. And you will see, you will surprise that those individual characteristics of a patient will cover all the diagnostic symptom of the disease. This will, this is a proof. This is a proof. And then you can say that, yes, this medicine will cure the patients. And you start that treatment in this way. And one another example of this criteria I want to give you. We were studying the geometries, algebras, and all that. And we were making the triangles congruent. If two arms, two angles of the triangles are equal, third will be definitely equal to that one. And we can say that if in individual patients, these individual characteristics, just like mental symptoms, the mentality, every patient, when it falls sick, his mentality is changed. His mentality is changed altogether. If he is having a pain abdomen and you are asking him, oh, let's go play, he will say, yeah, I'm having pain abdomen, and you are talking about playing or going to go to cinema, he will be irritated. In this way, the first thing we take the mentalities. If we are able to collect the mental symptoms of a patient, whatever disease he may be, and then on the second stage, we have his generality, means what type of things he is mostly affected with. Oh, if there is a rainy season, he falls sick. If there is a stormy weather, he falls sick. If there is a night, he falls sick. Or if the sun is rising on the daytime, he falls sick. These are some individual characteristics. There are many more, thousands, thousands of this kind of symptoms. But I'm just giving you an indication that if you take some of the symptoms of the sick persons, which are affecting the whole generality of the patient, whole general symptoms, affecting the whole body, whatever may be the symptoms, affecting the whole body. Oh, if he takes this thing, he suffers from diarrhea. Oh, if he takes this thing, he is constipated always. Oh, if he takes this thing, has this kind of symptoms. As a whole, the individuality is changed because he is taking this thing, or he is affected by this type of environments. Rainy season, dry season, night time, daytime, sun rising, sun downing. All these things are affecting the human nature. And how it is affecting the human nature, what change it has produced, if we are able to collect that. Because after taking these symptoms, we know that this symptom has changed the whole vitality, it is affecting the whole vitality. And then you select the medications on the basis of this one. And then under these conditions, you have selected some medication on the basis of the mental symptoms. Now you have selected some medication on the basis of his generality. And if you see, out of this big group, there are a little group which is common, which covers both things, mental symptom and generalities. Take it out. We have selected a small group out of thousands of medicines, out of hundreds of medications of which were covering the mentality, which were covering the generality. We have come across a small number of medicines. Now, come to the local disease symptoms. Local, because every time patient comes to doctors and say the present complaint, and we diagnose and we give the name to the disease. So now I'm talking about those symptoms by which a person has been diagnosed that you are suffering from this disease. Name the disease. And that has him, just like I call about the jaundice, icterus, pedia. And now, from mental symptoms, from generality, you have selected some of the common medications. And from those common medications, if you see whether during proving, when they were proved, when they were made medication, because substances are substances. Any substances, when it is used for preparing the medicine, is known as medicinal substance. Onion is onion. And when it is used to prepare the medication, it becomes medicinal substance. And when the medicine is prepared from the onion, and that's known as the elm shape or botanical name, whatever it is given, this is known as medicines. And when this medicine is selected on the basis of the individual patient's symptoms, this is known as a remedy. So now, from the mental symptom plus the generality symptoms, we have come across a small group of symptoms. And that small of group of symptoms, we are now checking whether from out of this small group, how many medications are covering the individual local symptoms. These are local symptoms. Pedia, skin yellow, or all these symptoms, weakness, everything. These are the individual symptoms of the disease. And you will see out of this one, a small group, you will find out few medications. You will find few medications which were covering the mentality, which were covering the generality, and also they are covering the disease symptoms. And those are the best medications for that patients. And they will remove the symptoms, disease diagnosis, as well as they will, you can say, give energy to the vital force. And they will make intelligent to your vital force that if the similar kind of condition will come up again, you will be able to combat that one himself. The vitality will be able to cure this kind of influences himself after this one, if we have treated the patient like this one. Because in life, we cannot claim that if a person is suffering from any disease, and we have cured him, and he will not suffer from that disease the whole life. He may suffer, but I am saying that our vitality will be stronger enough with this kind of medication, which is selected on the basis of a mentality and a generality, to combat himself that kind of disease, and it will not give you time to go to the doctor and select again for the treatments. No. And this facts, this is not my version, this is the version of a philosophy, medical philosophy of homeopathic, and we have verified it thousands, many millions of times. Honorable doctors have verified all these things in their lives, and they have cured the patients forever. I'm saying forever. It means most of the things, if they are coming at the same influence standard, it will not come up. But if it's more stronger, even then the vitality will be able to combat that one. Maybe vitality is still stronger, or some of the symptoms may appear, and ultimately the vitality itself is a continuously recovering himself, continuously combating, continuously protecting the life for its normal functioning. It will cover in a due course without any medication, any disease, anything. If happens from the any change in the environment, any change of the food temporarily, and ultimately you have treated this patient according to the this criteria, the triangle I told you, mental, general, and the local symptoms, and ultimately if ever he suffer from again same type, he has gone to the party and he has taken something which was not digestible to him in the past, and you have treated him, and ultimately if he goes to the party and eat the same thing, he will not suffer from the same type of criteria. And even if he suffers from, that will be taken care of automatically without any other help of the medications. So this is the principle of the nature which has been verified millions of times with homeopathic treatments, and this makes the homeopathic an individual characteristic type of treatments, and different from Ayurvedic and different from homeopathic treatments. Today, my time is over. I hope I have clarified the subject, how we treat, how we give medicines, how we select the medications for the individual patients. And if ever you are having any problems and which is not being cured, or which is coming up time and again on your system, means you are suffering time and again from the similar type of symptoms, and every time you take the similar kind of a medicine, because every patient is now taking bundle of medications. Every patient has in his almirah many medications which they are taking automatically without the instruction of the doctors, means over the counter of medication and taking every day, taking different times. So this makes your vitality more weaker, continuously taking all these things. Therefore, it's better consult a qualified homeopathic doctor and find out the individual characteristic medications for you, so that your vitality will become stronger enough to combat all these type of criteria, so that you do not suffer time and again from the similar type of symptoms, and you will not pack your almirah with the different kind of out over the counter medications at this time, because everybody is having this kind of things. So God bless you all. I'm your host, Gurdeep Singh Sandhu, homeopathic consultant, and my clinic address is 9701 Sarah and Court, Dublin, California, 94568, and phone number is 408 687 1899. If you see these lectures are beneficial to you, I am delivering these lectures every day from 5 to 6 p.m. on California Pacific Standard Times. And from head to heel, I am discussing this is known as a health education lecture series. So, health education lecture series, I am delivering the lectures for each individual portion of body, each individual system working inside the body, and how to treat them, what are the symptoms, how you can find out yourself. All these things systematically I am describing in these lectures, and you can join, and you can also inform your dearest and nearest relatives, friends, so that they can join with this one Sabarang radio station, sabarangstation.com, www.sabarangstation.com. And also you can join my YouTube page. There are, you can see thousands of lectures on health issues and different issues. And this thing I have started systematically. Oh, we were teaching in the medical colleges, because I taught about 26 years in medical colleges. And now, uh, not on that pattern, because those are the students who are well known with the biology and all these things. But here I'm teaching the general public. I know that they are not known to the biology, and I'm giving examples which are easily understood by the general public. And so that this is a different type of criteria I'm teaching over here. So if ever you like this type of things, and you want to understand more and more about your health, you can call, you can join this Facebook media. I'm on Facebook. You can become friend with Facebook, and I can, and you can listen every lecture when it starts. Or YouTube media, my YouTube channel. And ultimately, even if you are not available at 5 to 6 p.m. California times, you can listen these lectures on YouTube later on any times, which is best for you, and you can learn about your health. God bless you all. We'll see you tomorrow, and tomorrow will be a Hindi lecture. I hope all of you are well. Your, I'm your host, Gurdeep Singh Sandhu. Sat Sri Akal, Adab, Namaskar.